I am writing to share my experience at Stony Brook University Hospital. I am a Smithtown native who moved to Lake Grove and then to East Setauket in late 2019, so I've always known Stony Brook Hospital. Thankfully, I have not had much need to visit there. However, last Tuesday evening, March 8th, my 8-year-old daughter was at acrobatics where she injured her right elbow. We brought her to the pediatric emergency room late in the evening around 8 p.m., and from the moment we walked in the door, we were treated better than I could have ever hoped for. The nurses in triage were kind and gentle. We were on a cot in the hallway because all of the rooms were full, but it didn't even matter. Everyone who walked by engaged my daughter. They were genuinely concerned. A very nice woman offered her an iPad to watch a movie, which was so perfect because that is how she falls asleep at night, and it finally enabled her to rest. Then came the x-rays. We knew her arm was dislocated and likely broken, so we were sure moving the arm for x-rays was going to be quite unpleasant. I cannot remember the name of the gentleman in radiology that took the x-rays, but I really wish I could. He was so gentle and so patient. My daughter kept asking him to give her a minute, and he just took a step back and waited until she was ready. I could not have asked for anything more. When we went back to the ER, we met Dr. John Kennedy, thankfully a name I can remember. And he was kind and gentle with my daughter, and he explained everything to me slowly and succinctly. I am sure he could tell you who the rest of the team was. The other residents, the attending, the nurses, one kinder and gentler than the one before. They had to sedate my daughter to put her elbow back in place. This is a kid who has never gotten blood drawn, let alone an IV. The way everyone spoke to her and calmed her melted my heart. They let me stay with her until she was asleep and brought me right back in to see her when her eyes opened. We headed for another x-ray to make sure all was in place, and the second x-ray tech was as wonderful as the first. Even the people who transported us back and forth were kind and friendly. After all was said and done, she had a fracture that had to be repaired. We met Dr. Barsi and instantly knew he was the right doctor. He was willing to really explain things to my daughter so she would understand. Our appointment for surgery was yesterday morning, March 17th. Knowing the surgery center was not specifically for pediatrics, I didn't expect the same kind of attention. They let me go into the back with my daughter and stay with her. She was terrified and crying. Every nurse who walked past, and they were not the nurses assigned to her, stopped to talk to her and try to make her feel better. I was so relieved. I was allowed to be in the OR until she fell asleep, and no one made me feel like I was in the way. They brought me into recovery room, and her nurse, Nancy, was amazing. Every single interaction was more than I could have asked for. The best part is that my daughter had not one drop of pain since the surgery. I was so surprised I actually called Dr. Barsi's office to ask if that was normal. I wish none of this ever happened, but I am so grateful for the experience we had and so happy that your wonderful hospital is right in our backyard. While I hope we don't need to visit often, I am happy to know you are there.
Hearing from patients really means a lot. It gives us feedback that we're doing a good job. It makes me, happy that I went into medicine and especially orthopedics to really help people get back to their, level of sporting competition and to their level of activities. And it's really gratifying to hear too how they had a good experience, not just from myself, but from the entire team as well.
My sister has been injured at dance before, so have I, but when she was sitting in the room before we got to the hospital and she was holding the ice pack on and terrified and her bone popped out of her arm, it was terrifying. I'm just glad that people were helping her out because I know she definitely would have been a lot more nervous and very shaky if she didn't have so many people making sure she was okay, handing her iPads and just telling her what's going on.
As a mom with young children, the scariest thing is when they get hurt, and you have to be the one that keeps the strong, facade and make sure that they know that they're safe. And so being in a place where they were taking such good care of her, I was able to take a deep breath and really just concentrate and focus on her and not really have any of my own fear because they were really putting us both at ease.
I feel happy and grateful.